Welcome to the Obesity Medicine Podcast with your host, Dr. Matea Rentia, board certified in internal medicine and obesity medicine. Here, we talk about a path to metabolic health, and we have real conversations about chronic weight management and living a full life. Just a reminder, I am a physician, but I'm not your physician. So everything that's on this podcast is for informational purposes, but please go talk to your doctor about what's right for you. There is no medical advice being given on this podcast. Welcome back to another episode of the podcast. Today, we're going to talk about one of the most important and I think most overlooked pieces of metabolic health, and that's sleep. Sleep plays a huge role in appetite regulation, hunger hormones, cravings, insulin resistance, even how well I see medications like GLP-1s work. Yet it's often something that we just don't talk about enough. So I'm really excited today to be joined by Dr. Funke Afolabi-Brown. I'm sure I probably said that wrong, and I apologize in advance. I'm going to have you say it properly, but she is a sleep medicine physician and founder of the Restful Sleep Place, where she helps adults and children identify what's truly disrupting their sleep and creates a sustainable, evidence-based solution. Can we start out with you introducing yourself? When I asked, who do I need to talk to that's just an expert on sleep, a million physicians said, you are who I need to talk to.
Thank you so much for having me. I'm really thrilled and I'm looking forward to this conversation. I'm Dr. Funke Afolabi-Brown, a sleep medicine physician and the founder of the Restful Sleep Place. We have I guess I'll call it a boutique sleep medicine practice here in Horsham. And I do love to talk about sleep. I love to educate people. And I love to talk with a lot of clinicians about the importance of having conversations around sleep with their patients.
Before we even get started, when do people typically come seek you out? What has happened as far as sleep or how they're feeling when they actually take the time to find you?
Different ways. Sometimes people have been told it's, again, hormones, or you just need to lose more weight, and they've done all the things, but they're still, or you need to practice sleep hygiene, right? And so they've done all those things and they are still having a hard time where they're waking up unrefreshed and things like that. By the time they come see me, they are tired and they've tried everything. And that's literally what they say. I am tired and I have tried everything. And then sometimes, again, because one of my friends says sleep is having a moment. So a lot more people are talking about it. So sometimes I get some doctors who say, I know who exactly or what you need to do about this issue you've been having for a while. And then that really helps prevent like years or sometimes even decades of sleep deprivation. So yeah.
Totally. I think that's amazing because I find that people need to get to this point of desperation often before they'll listen to me on this or go see the specialist that I recommend. So I'm so glad that we're talking more about this because feeling tired and exhausted, it's really just not a way that people want to feel. Are there things that when someone comes in and they say that they're having trouble with sleep, are there physiologic things that you're looking for example, sleep apnea? What are some of the things you think about first from a medical context?
Oh, that's an excellent question. Really, when patients walk in to see me, or even if it's a curbside consult, we kind of start with almost like a three-pronged view when it comes to sleep. I start off with medical, like you said. So what are the medical issues? Now, this can range from many people know or more people are aware of obstructive sleep apnea or other types of sleep apnea. But then other things like restless leg syndrome, a lot of limb movements during sleep, all those things, even all those things can impact your sleep quality. Another piece under that medical umbrella that I often see is sometimes even micronutrient and supplement deficiencies. So I see a lot of women, especially who might have low iron stores, low magnesium, vitamin D, those kind of things. And then I'm also evaluating for things like thyroid disorders, because sometimes, again, they co-occur. So I'm looking at that. Finally, we are looking at just other disorders that potentially could be playing a role to poor sleep, chronic pain, fibromyalgia, those kind of things all are still under that medical umbrella. Even if I'm suspecting a sleep disorder, I still want to make sure we're not missing some of these things, reflux, all of those things. That's that medical prong. And then the second prong is more of the habits, right? This is where the sleep hygiene comes in. What are you doing in bed? What are you eating before bed? Are you consuming technology? All of that. So we kind of look at that because I think that's a very important foundation. And actually, some people are still struggling with that. And that might be a big contributor to their sleep issues. And then I call the third prong my 24-hour factors. If I have someone who has autism or ADHD or anxiety or depression, at baseline, they already just have a higher predisposition to poor sleep overall. When we do that, it's almost unlikely that we miss what's driving your sleep issues.
Oh my gosh, this is so comprehensive. The way you broke it down and then the 24-hour, I have a lot of patients, half my practice has ADHD. So
Mhm.
it's so fascinating when you're talking about stratifying it in this way, how then
Mhm.
something doesn't get missed. I hope everyone listening, if you're struggling with sleep and you're not getting this kind of a workup, that you would find someone as well educated as you on this to get help, because a lot of people, I don't think that they're getting this workup. And then they're just again and again being told it's perimenopause or whatever. It just gets hung on one thing. So if, let's say, someone's not feeling great, can we talk about why sleep is so foundational for metabolic health, especially for things like appetite regulation and maintaining weight, things like that?
Yeah. Oh, absolutely. So one of the benefits we know that sleep has, in addition to the restorative nature of sleep, it's not just about curing your sleepiness. It's really a process that's going on at night, right? Brain health, brain function, hormone regulation is a big piece. So when we talk about hormone regulation, it's not just like one hormone, it's a whole bunch of hormones, because we have a circadian rhythm, and really that's that 24-hour cycle, and the different aspects of the circadian rhythm that are occurring while we're sleeping. During the day as well, you get some effects of it, but it's regulated by the light dark cycle. But not just regulated by the light dark cycle, it also regulates a lot of physiologic processes, including metabolism, including hormone regulation. So when we don't get good sleep, we're missing out on those benefits. So let me give you examples of some of those hormones, okay? Cortisol. Cortisol rises in the morning, right? That's what gets us ready for the day. And it's supposed to have a natural dip in the evening. When we don't get sleep, we don't get that natural dipping process. And so you may get sustained high cortisol. Now, we all know, what does high cortisol do to our body, right? Significant inflammation, makes it really hard in terms of our metabolism overall, really impacts our cravings and our appetite and things. So that's one. And then we also have another very important hormone, insulin, right? This is what helps us with processing glucose and all of that, right? So when you don't get the natural dip in as well, then what happens? We start to develop over impaired glucose tolerance. We start to have more just difficulty with processing sugars and things like that, which is why one of the consequences of poor sleep is a higher risk of type 2 diabetes. Then in addition to that, we have appetite hormones that are impacted by sleep. So when typically there are two main hormones most people talk about when it comes to appetite regulation, but I wanted to talk about the insulin, the cortisol, because it's not just about those two. So two main hormones you might hear about, the leptin and the ghrelin. And the way I remember it, the leptin is a satiety hormone. It's what tells your brain, dude, you're full, right? Good. When it's supposed to be higher. And then, if it's low, then you're hungry. And then there's the ghrelin, and I say grr, because ghrelin is always hungry. So that's your hormone that makes you more hungry in that sense. So what happens if we don't sleep well is like there's almost like a flip of those hormones. So leptin, that's supposed to be high, is low until you're hungry all the time. And ghrelin, that we ideally want to be low, is high. So nothing seems to fill you up. And when you combine that, which is why I talked about just memory, brain function, brain health, decision-making capabilities, executive function is impaired with sleep. Now imagine dysregulated hormone with poor decision-making. That's not a good combination. So think of that situation where you've had a bad night of sleep and you are now just hungry. You're not going to go to the fridge and grab a bag of carrots, maybe the carrot cake, right? Because of all these things going on. And so really we can now imagine what that, and then you're too tired to exercise, or even when you exercise again, because of this high inflammatory state you're in, you really are finding it hard to lose that weight.
Yeah. But let me ask you, are there like a number of hours that you're looking for? Let's just take 18 and over. That's typically who's listening to this podcast and who I see there. And I know it can vary, but on average, what kind of quality sleep numbers are you looking for someone?
Yeah, great question. So really when we look at sleep, we look at restful sleep. I usually will say the quantity is very important. 7 to 9 hours is usually the recommendation in adults 18 and up. And it's a wide range. So you have to also listen to yourself, pay attention to how you're feeling. Are you waking up in the morning still tired? If, for instance, you think, oh no, I just need 7 hours. Well, if you're waking up in the morning and you're tired or you're starting to get sleepy during the day, you may need a little bit more. So you can play around with it. But in addition to that, you also want to look at the quality, because I have people who may sleep 7 or 8 hours and it's crappy sleep. And no matter how much sleep they get, they're still very unrefreshed. So I usually will say we want to look at both the quality, ideally 7 to 9 hours, it's a very wide range, as well as the quantity, as well as the quality.
What's your impression? Or do you use at all like the wearable devices? You know how like the Apple Watch, right? They're like, hey, here's your sleep score, and they're doing those kind of things.
Mhm.
Is there validity to that, or is that not something that you use at all?
Yeah, I actually use it pretty frequently with certain patients. If I have patients who have a lot of insomnia, where they're very worried about their sleep, they're perseverating, then that would not be a good candidate. But if I have someone who's just looking to optimize their health, they've not prioritized sleep. Now they're really on this mission to improve their sleep overall. And so looking at trends to say, okay, I made a certain change. Maybe I used to drink alcohol and caffeine all the way to the wee hours of the morning, and I've stopped it now. And now I want to see, I feel like that feedback is beautiful to now see, wow, I'm sleeping more consistently. I have less wake ups versus somebody who's like, oh my goodness, my sleep score said, or my deep sleep was this and my REM sleep. Now I'm worried. So I think it's really more about how you use it. I use it to help coach a lot of my patients, especially as they're trying to optimize their sleep habits and their sleep schedule, rather than make it the end all be all. And then in terms of the trends, it's really looking at, okay, the time you're being awake, the time you're sleeping, again, versus all the minutia details of deep sleep or REM sleep. You do want to be careful with how you use that data.
Thank you for giving so much clarity on that, right? I do
Mhm.
find sometimes what you were saying, too much data creates so much anxiety. It's like with CGM, it can be really helpful, but if we're using it too much, it really can drive you nuts. A follow up with this 7 to 9 hour kind of being the optimal, what we're looking for. What about this concept of like sleep debt recovery? Can you take a nap during the day? Or is that not something where it's just kind of like with time, you have to have a good rhythm? Can you make up sleep that you've missed?
Yeah, they previously used to say this sleep is not a bank. You can't be like, oh, I'm just going to bank good sleep and just go partying all night long. If you do the math, it's going to be really hard to catch up, especially if you're somebody who is chronically in sleep debt. There will be a time where you'll be 12 or 13 hours in sleep debt. How are you going to pay that off? You're not going to sleep 24 hours. You just can't do that. So you have to really be careful. But say, for instance, I work with a lot of athletes, I work with a lot of people who travel around the world. And they say, well, I'm going to have an intense season where maybe for the next 5 days, my sleep is going to be like all choppy. Well, maybe now we know ahead of time, we could build a schedule whereby we're quote and unquote banking that sleep so that we can try not to enter that season with so much sleep deficit. And then as soon as we can, we start to try to maybe sleep a little bit longer, as much as you can. But it's not the ideal because, again, in addition to when we talk about restful sleep, the third thing I left out was the timing of sleep and the rhythmicity of sleep, quality of sleep, quantity of sleep, and the rhythmicity and the timing. Really, the best thing you can do for your circadian rhythm is to have a consistent sleep time and a consistent wake up time as much as you can. Again, depending on who's going to be listening to this, I don't want you to feel like, oh my goodness, I'm going to shut everything down because of that, right? Life is life. So knowing that will accumulate some sleep debt. How do I know proactively and prepare for that? Well, maybe I'll try to give myself a little grace. I'll try to nap when I can. The thing about naps is you do want to be careful. I'm sure this will resonate well. I look at naps like having a little bit of snack for your dinner, right? You don't want to eat this giant, like, pretzel with a bowl of ice cream and you're not going to be hungry, right? The same way, if you want to take a snack or a nap, as I would call it, you make it short, you make it sweet, you make it earlier, a little bit earlier in the day so you can have enough time to build a high enough sleep drive to be able to sleep at night. But if you do, like, again, you've had a rough night, or maybe like a mom who just had a kid and sleep is all over the place, well, yeah, you could take a little bit of a nap. If you have insomnia, right, chronic difficulties, falling asleep, staying asleep, all of that, you do want to stay clear of a nap because that will make your insomnia worse in some situations.
Definitely. I want to just follow up real quick because I've always wondered about this. If you have somebody traveling time zones, whether it be vacation or work, like you were saying, are there any tips for how people can adjust to the new time zone best?
Yeah. Jet lag is very common. The important thing is number one, you want to figure out where you're traveling to, right? If you're traveling east, where you are losing time versus west, where you're gaining time. West is actually what we say. We usually say west is best because it's more about just you're going to stay up for longer. That's what it is.
Yeah.
But for east, you're going to bed at an earlier time than you typically would. So the goal is again before travel, you do want to know what the time zone is, how much time you're going to lose, what the plane ride, what does the flight look like, and then make sure you're not going in with sleep deficit. I think it's important. And then as soon as you get on the plane, you want to adopt you can start gradually shifting your body clock even before. So if, for instance, again, if you're going eastward, you may start maybe trying to go to bed a little bit earlier, as much as you can. It's not perfect at all. And then as soon as you get on the flight, I would always say, change your times right away to the destination time zone and adapt whatever. What would they be doing? Would they be asleep right now at the destination zone? And if that's what you need to do, you're going to put the sleep mask on and try to take a nap. And then, if it's morning there, again, you let the blinds open so that you can get as much light as possible. Meal times, you want to adapt to their meal times as well. So if they're trying to serve you like some large dinner when at that time zone, you know that everybody else is asleep, then, you want to avoid that. Of course, you don't want to be hungry, but just to be aware, you want to stay hydrated. Dehydration makes jet lag 100 times worse. So you want to try to stay hydrated, avoid the cheap wine that they're serving you or offering you on that flight. It's not worth it. It's not worth it. So you really want to make sure, again, the pressure change, it makes how you process alcohol different. It worsens that dehydration. So those kind of things. And then when you get to the destination, again, just jump right in. If it's daytime, if it's morning, get rid of those sunglasses, no matter how cool they look. Get light into your eyes as much as possible. And then in the evening, as evening approaches, then of course, you want to avoid bright light. So those will be some things. Usually people say it's about an hour per time zone crossed for you to adjust. I'm sorry, an hour, a day per time zone crossed, per hour of time zone crossed. But with those tools, you can actually move a lot faster.
Yes. Okay. Thank you for that. Because I know that's something that people really struggle with. Along those lines, do you have recommendations as far as when people should stop caffeine intake?
I would say the half-life again varies like 6 to 8 hours. So just rule of thumb, if you're a 10 p.m. bedtime person, you probably want to be done with your very last cup of coffee by 2 p.m. I would say 2 p.m. at the latest. That way, at least you have time to metabolize it and get it out of your system. And if you notice like, oh, 2 p.m., I'm still pretty sensitive and I feel like I still have it in my system, then you may need to stop even earlier.
Yeah. Okay. That's good. I've always heard noon and I'm like, but that's so
Yeah.
early.
I know, right?
I struggle with the noon, but 2 o'clock I can do. Can you explain to us about how alcohol impacts sleep?
Alcohol is a sedative, and so it helps fall asleep. It knocks you out. The issue is that it is metabolized by the liver very quickly. What you might notice is maybe the first half of the night, decent sleep. And then once it starts to get metabolized, you really start to see, and it suppresses REM the first half of the night. You now might get a component of what we call rebound REM. You might not get enough deep sleep. You might have sleep fragmentation. And so as a result of that, waking up feeling tired, what people call the hangover. And then the other thing is that alcohol also relaxes because it causes your body to relax. So it can relax your upper airway muscles. So if you're somebody who has a history of snoring or you have a history of sleep apnea, it can actually worsen sleep apnea. That's just something to be very careful about. So really, we recommend avoiding alcohol before bed. Of course, most people take alcohol in the evening, but for what it's worth, I'm not saying go completely off if that's not what you prefer, but just being aware of that. The crappiness you feel right now was because of the nightcap you enjoyed last night.
I'm glad that people hear that because
Yeah.
sometimes it gives you options of what to work on.
Yes.
I put it that way,
Yes.
right? Um,
Yes.
and I think
Yes.
so. I want to ask you, there's so much out there about different supplements and things like that. What are your thoughts on magnesium, melatonin, mouth taping? I feel like I see that 24/7. What are your thoughts on some of those, either the supplements and then like the things like mouth tape?
Yeah. So with the supplements, I think as someone who has a more of a holistic approach to sleep, health, I do offer supplements, but I think it's just really important to understand why. What we typically recommend within the sleep community is more targeted supplements. For instance, rather than just grabbing the stuff off the shelf, try to figure out why, right? Because everybody just goes out of desperation to the stores and grabs the melatonin, magnesium, ashwagandha, all of that. Really understanding why you need it, because melatonin can help in terms of facilitating sleep onset, but it's usually more used in people who have maybe like a slight delay in their circadian rhythm, maybe people who have shift work, who are shift workers, or people who have what we call delayed sleep wake phase syndrome. There are actual indications for these kind of supplements. With magnesium, it helps with reducing tension and promoting relaxation. So in a certain situation, it might be helpful. But if you're going there, if you're somebody who has insomnia or you have unrefreshing sleep, I would I would recommend getting that evaluated so we can figure out the root cause. Because if you have sleep apnea, there's no amount of sleep aids that's going to help that situation. And in fact, if you have insomnia and maybe you have some kind of rhythm, abnormal rhythm problem, melatonin might actually make it worse. As you use supplements, understand why. Many of them just say safe, benign sleep aid. If you think about it, Tylenol PM, it's not meant to be used every night because we know that Tylenol to your liver over time is dangerous. So at the end of the day, even though this Band-Aid gives us a quick fix, it may potentially be causing harm long term.
Yeah, I like what you're talking about with the guidance because I use some supplements
Yeah.
as well, but exactly it's not I hate when people are just taking 15 randomly
Yes.
and they've had no testing, there's no reason for
Yeah.
anything, there's no
Yeah.
logic. So
Yeah.
100% to what you said. What about the one with the tape?
Yes, with the mouth tape, this has become like a very popular fad more recently. The way it is, some people are mouth breathers, and so it helps with promoting nasal breathing. Nasal breathing is the number one way we should breathe, is the healthiest way to breathe. And for some reason, people are not able to breathe through their nose. And I would say, just like with the supplements, why is that? Why are you not breathing through your nose if the nose is supposed to be the way we're supposed to breathe? There are many reasons. Sometimes you might have an obstruction. Sometimes you might have sleep apnea. Sometimes you might have a nasal polyp or a deviated septum. So your mouth habitually is open because you couldn't breathe in through your nose. So just putting a tape over can potentially not be the safest thing to do because you just shut up your only exit, your only means of survival. But on the contrary, if you've had a sleep study, you've seen an ear, nose, and throat doctor, you've had an evaluation, and all we have now is just relaxation of your jaw,
Mhm.
but your nose is patent. We know we can confirm that you can breathe through your nose, then it's fine. But again, let's figure out why,
Yeah.
because we do not want to turn a terrible or an uncomfortable situation, aka mouth breathing, into a disaster.
Yeah. Yeah, I'm really glad that yeah, they always present things like just buy this one
Yes.
product and it's never
Yeah.
that easy. So I'm so glad that you brought that up. If you were to talk to someone, and let's assume that we're talking to someone that here and there is struggling with sleep, right? Maybe like 3, 4 weeks at a time, but it's not like a chronic insomnia for years, because I feel like that's a different treatment compared to, let's say, maybe like stress induced or things like that. What would be some of the top tips you would give that person and just a person in general for do these things so that you maybe have better sleep?
I would say we want to make sure we cover basics first. Basics is so important. Whether it is having that consistent sleep schedule, having a bedtime routine, making sure that your room is cool, it's dark, it's noise free, making sure that you're avoiding any non-sleep related activities in the bedroom. Those kind of things, the technology, we're shutting it down about 30 minutes to 60 minutes before bed and things like that, the limiting the alcohol, caffeine. I think that's very fundamental. That's something you can start tonight. And I usually will say, let's start with those basics. Maybe you've done that for a couple of weeks and you're still like, I'm tired. I am still not sleeping. My mind is racing. Or another thing I would say is incorporate some self-compassion exercises in your bedtime routine. If you've been busy all day, you've not had time to process any of your thoughts, we may do some guided meditation, we may do prayers, we may do some journaling. Those kind of things can help offset that busy mind. But if you've still been struggling in spite of all of that, it might be worth just speaking to a professional. And when I say professional, I think usually what we start to do is, do we need evaluation? Evaluation for a sleep disorder, evaluation for insomnia. And then based on that, we can then talk about cognitive behavioral therapy, especially for someone who's struggling with insomnia. That's really the gold standard, cognitive CBTI. Of course, if you have sleep apnea or other risk factors, then, that evaluation is also very important.
Yeah. Is there something about how someone would be able to tell the difference between just, I'm just tired versus this is something that needs more evaluation?
I usually tell people there's a difference between tired and sleepy.
Yeah. Okay.
And most people mix them up. Tired could be burnt out, tired could be sad, tired to be just overwhelmed, tired could be overworked and in need of vacation. Sleepy is literally, I can't keep my eyes open as I'm talking to you, or I'm driving and I find myself nodding off, or I'm sitting in a public place and I'm just blacking out pretty much. If you're tired, sometimes sleep might help, but many times that may not be the only solution. If you're sleepy, good sleep will always help.
Thank you for defining the difference of these because
Yeah,
100%, these are like two different,
yeah,
way different ballparks.
yeah,
So, I
yeah.
mean,
And the approach is different. Like tired might be depression, but
yeah,
sleepy might be sleep apnea, might be narcolepsy, might be chronic insufficient sleep. And so teasing those out, like what's happening to your eyelids when you're sitting in a room. If you're nodding off, then yeah, you're sleepy. And then we can go back and say quantity, quality, timing, a disorder, those
yeah.
kind of things.
You- I was just thinking about because I'm seeing obviously all my patients are on some type of a anti-obesity medication, and a lot of them will lose a lot of weight. And I'm
Mm.
wondering what's the chance that they can actually come off of like a CPAP machine, things like that.
Weight loss will reduce the severity of sleep apnea, whether it's through GLP-1 or diet and exercise, surgery, other medications. When now, what percentage of weight loss will resolve your sleep apnea? We don't know because the mechanism for obstructive sleep apnea in patients with obesity is multifactorial. It's not just like, oh, it's fat, you lose fat, then the sleep apnea goes away. There's a tone issue, there's anatomy, there's a whole lot of things that play a role. But that being said, we do know that weight loss will reduce the severity. Whether it's reducing it by 50% or 20%, it's a wide range. Even from the studies in Surmount OSA with the Zepbound and all of that, we saw that. So that being said, this is what I usually do, and most of our colleagues recommend is if you've lost significance, when we say significant, at least 10 to 15% of your baseline body weight, it is absolutely helpful to repeat your sleep study. Because one, we could get resolution of your sleep apnea. That's a possibility. Two, we might get reduction in the severity, which now opens you up to various options like, oh, maybe we can wean you off CPAP and transition you to a different type of therapy or just transition you off completely. It's always helpful. So usually I would say around that 10 to 15% decrease is
Thank
good.
you for saying that number because I was like, when do they need to get reevaluated? So you
Yeah.
read my mind on that, right?
Yeah.
I know we've talked about a lot today. Do you think there's anything that we haven't mentioned that's really important that people should know?
No, I think we've covered a fair amount. I would say just prioritizing it. I mean, I think the way our systems are is built that a third of our lives are meant to be spent sleeping. And if you think about just the power of a good night of sleep and how it impacts, again, your metabolism, your brain health, your heart health, your mood, your emotions, every of that, it's like the gift that keeps giving.
Yeah. I love the way of thinking about that because I find people get sucked into the
Mm.
screens at night. And then I really understand it if you're a mother or something. It's like, that's my me time. Finally, everyone's gone to sleep. I can empathize with all of it. But to your point, 100%, to me, I'm always like, this is the number one thing. I would rather you do this than any of this other stuff because we really can't work on the other stuff if you're sleep deprived. There's an empty tank. Yeah. So thank you so much for coming on today. I know that everyone's going to have learned so much from everything that you shared. Can you tell everybody a little bit about where can they find you either online, your website, the best way to connect in all aspects?
Yes, and thanks so much for having me. My website is the restfulsleepplace.com or restfulsleepmd.com. It's the same. I have a lot of stuff on social media, and I also have a YouTube channel where we talk sleep all day, all the time. You can find me at Restful Sleep MD, on YouTube at Restful Sleep MD, on Facebook at Restful Sleep MD, on LinkedIn. I'm licensed in terms of my clinical practice in Pennsylvania, New Jersey, California, and Virginia. I do offer coaching services. So for those states where I'm not licensed, I do offer coaching, just really providing guidelines on how you can optimize your sleep from a behavioral standpoint and things like that across all states. And our website, you could just hop onto a quick call on our website to learn more.
Thank you for sharing this. Everybody, we're going to have it linked in the show notes. So if you go to rentiaclinic.com, you click on podcast, we will have all of this there. I know that it's really hard, at least for me, it's been very hard to find good people to send my patients to. And also the coaching aspect that you're talking about, because oftentimes the CBTI that you're talking about, really hard to find someone that's good at that. And I've seen it change so many people's lives. So I'm so glad that you're sharing all of this with us. Just thanks again. And I'd love to have you back in the future because I know there's going to be so many questions that pop up.
Yeah, absolutely. I'm so appreciative. Thank you so much for having me.
That marks the end of today's episode. But if you're newer to the podcast, I want to tell you about something that we have, and it's a free podcast roadmap. So this is perfect for any of you that are listening where you want to be directed to very specific episodes. So let's say that you are just starting out and you want to know, what should I do right when I start on the medications? Or you're experiencing certain side effects on the GLP-1s, or you want to know what to do if you're in a plateau, or if emotional eating is taking over, or if hunger levels are high. So we have many different categories of episodes that we've talked about, because there's a lot at this point. So if you want to be able to navigate that very easily, we have it broken down by category, and also the episodes that are there, and we hyperlink to everything. So you can just click on it and find the episode, easy peasy. If you want that, you can go to rentiaclinic.com/podcast roadmap. We'll have it linked right here underneath the show notes where you're listening. And you can go ahead and get that free resource so that it makes it easy for you to navigate, because I know that it's really hard when someone has an established podcast. I am such a podcast fiend, listening to podcasts all day long. And when I find one that I love, but there's a lot that are out there, I am so lost. So I hope that you enjoy this free podcast roadmap. Again, the link to get to that is going to be rentiaclinic.com/podcast roadmap. I hope this is helpful, and let me know if you have any questions.